Okay, so this is my very nice patient who came to see me, and she has a vision trouble because she's quite a bit nearsighted, and she decided to take the plunge and consider having LASIK surgery. And so first I wanted to say thank you for meeting with us, and tell me, what kind of trouble were you having with the vision that made you think, okay, this is what I want to do?
So I have been wearing glasses since I was in the 2nd grade and then transitioned into contacts. So I've been having vision issues the majority of my life. I could not see probably 5 feet in front of me as far as reading any kind of text.
Right.
Driving, that's just a terrible idea. So without, any corrective lenses or anything. So having this LASIK surgery has been a huge lifestyle change for me. It's just amazing to wake up in the mornings and be able to see. So I'm really glad that I did it, and wish I would have done it a long time ago.
So yeah, I mean, I'm glad that you're doing so well. You're about a week out. Tell me, what was the surgery itself like? Was it hard? Was it easy?
The surgery was actually very simple. I went in there totally at peace. Dr. Kim and all of his staff were great. It didn't take very long, maybe about 10 minutes or so. And then post-op care has been very simple as well, just, with the eye drops and everything. So a lot of people can have anxiety with that. It was not that bad. A lot of people are like, oh, I'm so afraid of having surgery done on my eyes. And I kind of had that fear at first too, but it was great. It was not bad at all.
Good. So like you said, most people don't like their eyes messed with, and so that's very common. And for you to feel that's very common too. But as you've now looking back at it, it's nice to hear that you didn't feel like it was as bad as you thought it would have been. Obviously, we had to do some things to you. You still have tiny little blood spots on the wide of the eye because we had to apply a suction cup to hold the eye still as we created your flaps. And so, yeah, it sounds like you did very well. And so tell me, once you opened your eyes after the surgery, how long did it take for your vision to come in, and what was one of the first things you noticed?
Immediately, it was way more clear than prior to. My eyes were burning afterwards.
Sure.
But once I woke up from my nap after that, vision was perfect. It's been amazing. So I'm very, very pleased with my results.
Good. Yeah, we checked your vision, and you're seeing 20/20 without anything on your face. Great. And so that's really great. And so, so is there anything in particular that you're just kind of, you said obviously, you wish you'd done it sooner, but I mean, just day to day, are you feeling like you're missing your contacts or glasses, or you're kind of searching for them? Do you feel like you have any visual dysfunction now that you've had this taken care of at all?
No, and it's funny that I'm not missing my glasses, because usually I would be constantly adjusting my glasses, pushing them up on my nose. I didn't wear my contacts quite as much, but it's just great to wake up and be able to see, not have to worry about finding my glasses to put them on and be able to see what I'm trying to do. So again, very pleased.
Great. So, if anyone asked you and they're kicking the tires about having something like this done, tell me, what would you say to them?
I would recommend it to all my friends, family, whoever. It's just been a great experience, and again, not as scary as what you would think it would be. Very quick, non-invasive, just overall a great experience.
Well, great. Well, thank you so much for sharing your story. I know it's awkward to talk about these things, but as I shared with you, there's a lot of people who ask these questions, and they really want to know. And so just hearing like real people talking about this and like what it's like and so forth, it just gives them an opportunity to put a real face to a real person. And I think that's really important. So thank you so much for sharing your story. We really appreciate it.
Happy to help.
Thank you.
Thank you.
You're welcome.